Hi, my name is Vanessa, and I am starting my video journey of my gastric sleeve um, journey. I just said that. Anyways, this is a video or my video journey about me having the gastric sleeve. My surgery date is January 21st. And I think I'm actually more nervous about making these videos than the actual surgery. Again, my name is Vanessa. I am 30 years old, and I will be having my surgery in about 12 or 13 days from today. And this video is basically about PCOS or trying to conceive TTC and the VSG, the vertical sleeve gastra something. I forgot what it's exactly called. And basically, I searched all over the internet about PCOS and the surgery, the vertical sleeve, or the gastric sleeve, as some people know it as well. And I couldn't find anything that had to do with PCOS and the actual vertical sleeve. A lot of the things that I saw on the internet had to do, or the videos that I saw on YouTube had to do with people, all happy about how they lost weight, and all those other good things that come along after surgery, or people talking about how they're not happy with themselves, they think they look ugly. That is not the case in my scenario. The case with me, or the story with me, is I have polycystic ovarian syndrome. Luckily, I do not have the acne that goes along with it, or one of the side effects of it. But I do have the diabetes, the facial hair that I get constantly having to pluck and wax and do all kinds of crazy things to stay looking feminine. And of course, weight loss. Weight loss is extremely difficult for anyone with polycystic ovarian syndrome. And trying to conceive is nearly impossible. I am a newlywed. I just got married, I want to say about 7 months ago, May 31st. I married my best friend. La la. And now we're trying to have babies. Or even before then, we decided, hey, we knew that we were going to be together, or, we do plan on being together forever, and we wanted to start a family. So with that being said, we tried, or I should say I tried fertility medications. I did some rounds of Clomid, didn't work. Metformin, because I'm diabetic, I take that every day anyways, and that doesn't work for me. And this, I tried the Ovacube. I don't know if anyone has heard of it. I'm sure if you've tried to conceive, you've heard about a lot of these things. This is pretty pricey. So we paid a pretty penny for this. It has this thing here. Put it on your tongue starting the first day of your cycle, and it measures your hormones. And this thing is after your cycle ends. You stick it in there, and it measures your cervical mucus. And basically, what that does, it'll tell you the days you're going to ovulate, and if you did ovulate. None of that worked for me. So my story begins actually it actually begins way before that. When I first started my menstrual cycle back when I was 12, ever since the first time I've had it, maybe the first year, it was regular for 6 months. After that, it basically disappeared. I would get it every other month, every 3 months, and all my family were Hispanic, and they would all tell me, oh, your periods are going to regulate after you hit 15. Well, hello, 15 came and went, and I still didn't have regular cycles. So from there, when I turned about 19, I went kaboom. I was already a little thicker than most people, but I wasn't big like this. So after that, I just gained so much weight so quickly. I became diabetic, but it was still controllable. And I remember back in 2005, I had my gallbladder removed because I had just gained so much weight so quickly. I had gallstones and, oh God, all kinds of things. Luckily, diabetes and PCOS is the only thing I have, although my diabetes has gotten very, very bad to the point where I have to take insulin. I take 2 different insulins, and I'm also on metformin twice a day and glipizide. So I try to control it. And now, fast forwarding to now. Back in 2013, I had all the workup for a weight loss surgery because I saw a fertility specialist and they said, look, you need to lose weight. And I was in denial because I would see these women who were 300 plus pounds, and they were getting pregnant. They were having kids, and I thought, you know what? If they can do it, why can't I? And unfortunately, that wasn't the case for me. Everybody's different, and that's why I'm making this journal or video diary type thing, to document my experience, what I'm going through, and for me, because like I stated previously, I wanted to see a video about someone saying, hey, I had PCOS, and after a month or 2 months after surgery, I got my period, or I got pregnant, or, even though they don't recommend to get pregnant right away, I'm not saying go ahead and do it. I'm just saying, I wanted to hear someone's story. What did you stop growing hair? Did your hair thin out more? As you can see, when you have polycystic ovarian syndrome, your hair thins out. Your hair is very thin. My hair is extremely thin. I have oily skin. Like I said, luckily I don't have acne. But you grow hair in places you didn't think you could. And I know that's probably TMI, but it's the truth, and anyone with PCOS will tell you it's not a very nice thing. Also, too, I wanted to basically say how I got here. So, like I was saying, back in 2013, I had all the workup done. And when my surgeon, who at that time was going to be Dr. Powell, I don't know if I mentioned this, but I live in Los Angeles, California. Woo, Cali. Anyways, my doctor, Dr. Powell, at that time, well, he was going to be my surgeon. They submitted all the workup. I did everything. My insurance said, this is excluded from your policy. So I was left devastated. I was like, oh my God, I was so ready for this and I couldn't have it done. And thanks to the Obama care and the whole insurance reform, I qualified for Medi-Cal, and now I am here. I have no children. I don't know if I stated that. I have no children, and I can't wait to be a mom. I know a lot of women out there who are probably in my situation know exactly what it feels like. Day in and day out that that is your dream and that is your goal. And this surgery is going to help me. I pray that this is going to help me achieve that goal. It's only natural that after you get married, you want to have children. And I'm ready. I'm 30. I think I've done a lot of stuff that most people haven't done in my age or experience, and I'm ready to experience that next step, which is motherhood. So I welcome all of your guys' questions. You can email me. My email address is Bonnie, BONNIE 8488 at att.net, and I will keep you updated. Again, I am 13 days away from my surgery, and I am excited. I have my workup done, my pre-op workup on the 15th of January, which is next Thursday. It's also my husband's birthday, so I'm very excited. And I hope that you guys all follow me, and I welcome all comments, especially supportive ones. Anything negative, look, keep your opinion to yourself because no one has time for it. And again, welcome to my journey, and I look forward to sharing more of it with you guys.